Internal oblique.
Internal oblique. And what about this one that goes at an angle?
Transverse abdominis.
Transverse abdominis. Very good. And this one that goes longitudinally right in the center?
Rectus abdominis.
Rectus abdominis. Rectus abdominis. This is what gives the six-pack, right? And this is the latissimus dorsi, gives that V shape. And then all these trapezius are right on the neck. If you look in the human, I was showing the other guys. See, this is acromiotrapezius, it's trapezius muscle. This is clavotrapezius, all trapezius. So in the human, you got this, like it's the neck, and then you got the trapezius, which will be this. And then on the back, you also have the trapezius muscle, which continues like that, and then goes all the way here. So this is the spinal trapezius, also trapezius in the human. So all this is trapezius, trapezius, trapezius up to here. You should look in the book if you see muscular guys, bodybuilders. That's all. That's why in the human it's all trapezius, trapezius, trapezius. Because it is really one muscle with different heads. This one, and that one.
You skipped the Raiders captain.
I was just showing you the.
no, you did
I
the
forgot. What's this, ladies and gents? I forgot. You see what I'm saying? No good. Yeah. Levator scapulae. Levator scapulae, because it's one that elevates the scapula. All right. Levator scapulae. Levator scapulae. I don't think I forgot anything else. You see how it starts here? It goes like that, nicely, and then that's that. So that's good. We get that. That. And this we got it. Serratus we got, and then we got all these chest muscles, and we got all the abdominals. We said this is external oblique, internal oblique, transverse abdominis, and then rectus femoris. This is what gives the six-pack in the human. Now we go to the leg. Phew, the leg has got a ton of muscles. It's not even funny, right? So what is
Sartorius.
Sartorius? Wow, there you go. Sartorius. And this? Yeah, it's the same one. It's the same one. Because last time I pointed to it and people were talking about a different muscle. I was like, no, that's the one we cut, remember? Anyway, I was just testing to see,
Oh, that is the tensor facial.
No. Starts with an R though. Starts with an R. Two words.
I can't remember the second word.
Yes, rectus femoris. Excuse me. Oh, crap. Rectus femoris. Sartorius. Very good. So this one right in the middle, this one here, what's that? Well, you gotta say it the other way around.
Lateral vastus.
No. Starts with the V word.
Vastus.
Not the other V word.
Okay.
Anyway, you have vastus lateralis because I didn't want you to say. Just kidding. So vastus medialis because it's in the middle. Vastus medialis. Yes. So when I say in the middle, you chime in vastus medialis. All right, and this one is kind of sort of in between.
Vastus intermedius.
You see this nice fat round muscle. What's that?
Vastus intermedius.
Yes. Vastus intermedius. Same name in the human, right? Very good. So I'm gonna flip him over like that, and then this one here that starts kind of sort of on top a little bit, but it's mostly on the side. What's this?
That's the tensor facial.
No.
The one
I'm pointing to the big fat muscle here. See this muscle here? It's under the fascia here. You see this? You see that? All that? What's that? Yeah, vastus lateralis. Because you gotta pronounce every word. Vastus lateralis. Same in the human. It's on the side. Okay, vastus lateralis. And then of course this one is in the middle. So it's intermediate between the vastus lateralis and the vastus medialis. So it's intermedius. Vastus intermedius, and this, of course, is in the middle, vastus medialis. Okay? Now you can spit it out, you can chime in. This one here, that's got made of this fascia and this muscle, is the
Tensor facial.
yes, tensor fasciae lata. So in the exam, I'll put a sticker right there on the tensor muscle. So you say tensor fascia lata because it's on the side. Okay? I won't put it here because then this will rip off the fascia. You know what I mean? So I'll put it on the tensor muscle, tensor fascia lata. Okay, so what about this? Yes, cordofemoralis.
No.
No equivalent. Thank you. appreciate. What about this right here? Gluteus maximus. Gluteus maximus. This one here? Yes, gluteus medius. Very good. What about this one right here?
Oh wait, no.
No, this is
Another one, yeah.
two words. Starts with a B. No? But you're on the right track.
Biceps femoris.
Biceps femoris, not femoralis. The other guy said the same thing. So it's biceps femoris. 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 Biceps femoris. Okay, not femoralis. Okay? This is the quadrifemoralis. This is the biceps femoris. Biceps femoris, biceps femoris. Okay? And this one here that looks like a tendon? Yes, semitendinosus. Semitendinosus. We go back again to the inside. What is this one here? Gracilis or gracilis, whichever one you like. The same as here. That's how it's spelled. Gracilis. Gracilis or gracilis, whichever you like. And this one here, which looks flat like a membrane, semimembranosus. This one looks like a tendon, kind of long, semitendinosus. Semitendinosus, semitendinosus. Semimembranosus, semimembranosus. What about this big fat one in the middle here? What's this? Adductor femoris. Adductor longus in the human. Okay. What about this long, thin one here? Exactly, adductor longus, adductor longus. Because I didn't want to be redundant, I didn't list it twice. I just put the one that's not in the human, which is the adductor femoris. And then I said adductor longus in the human column. And then this long, thin one is also adductor longus in the cat, and it's the same adductor longus in the human. So that means in the human, this one big long muscle is adductor longus. There's no, it's not split in two like the cat. That's what it means, right? Because the adductor longus in the cat is also adductor longus in the human. The adductor femoris in the cat is also the adductor longus in the human. So in the human, it's just got one long muscle called the adductor longus, and that's it. Okay? And then this one here on the side, this one, right, this triangular muscle right here is the pectineus, but it's not on the list. It's one of the muscles that I'm going to put on the list together with the xephumerus for next time, not for you guys, okay? That's about it. But anyway, because it's right there, I show it to you so that you can differentiate it from this adductor longus. Mine, I kind of, mutilated it, you know what I'm saying? But I bet some of yours is nice and, undamaged. But that's what that is. Adductor longus, adductor longus, adductor femoris, adductor femoris. I know adductor longus. Yeah, you got me. Thank you. So we got all that, and we flip him back again. we got all that, right? We got our nerves. So this big fat one in the back, what's this one? Starts with a G. Gastrocnemius. These are the calf muscles. Gastrocnemius. Spelled just like that. Gastrocnemius. What about this one here? Yes, soleus. Yes. What about this long one here? Peroneus longus. The peroneus longus. Okay, now you can chime in. No, that's extensor. Longus? Yes, extensor digitorum longus. Okay, very good. You see the tibia right here? Do you see it? I split mine into that. So peroneus longus. Extensor digitorum longus. It's kind of hidden in front by this muscle. You have to peel it out. Did you see that, guys? Yeah. See, it's like that. So you peel this off like that. There's the extensor digitorum longus. And then right in front of the tibia is this muscle, which is?
Tibialis anterior.
Tibialis anterior. We're done. That's it. The ones they were confusing with is the flex